Hello, and welcome to our Facebook Live COVID-19 update. My name is Joe Sullivan. I'm a family physician and one of the Oregon Health Authority's senior health advisors.
Hi, I'm Dr. Paul Cieslak. I'm the medical, forgot to take my mask off. I'm Dr. Paul Cieslak. I'm the medical director for communicable diseases and immunizations here at the Oregon Health Authority and an infectious disease specialist.
Before we begin, I wanted to take an opportunity to talk about masks and face shields. As many of you know, the Oregon Health Authority recommends that when indoors with people who are not members of your household, you should be wearing cloth or paper face masks. Face shields, we know, are not as good as preventing infection, and so are not recommended. However, in our Facebook Live audience, we have wide viewership, some of whom do not speak sign language and do depend on seeing speakers' lips and mouth. And that's why, while speaking, we'll be using face shields alone. So, on to today's topic. Today we're going to be talking about the importance of flu vaccination in the time of COVID-19. Before we get to that, I'd like to give you a quick update on Oregon's COVID-19 situation. So, like elsewhere in the country, Oregon's case count has been increasing since the beginning of September. And last week, unfortunately, we saw the highest daily case numbers since the pandemic began, peaking at 550 new cases on one day. And so where are we seeing the biggest rise in cases? It tends to be in people in their 20s, 30s, and 40s. They account for almost 58% of our cases. And the importance of this is that a lot of these cases are sporadic cases. Those are cases without known exposure to another known case. And this is a measure of wide community spread of COVID-19. An example of that is here in Multnomah County. We're currently at 50 cases per 100,000, which puts us back on the watch list. So deaths largely remain in the elderly. About 75% of the deaths are in those over 70 years old. Now, some communities in our state have been hit particularly hard, whether it be the African American community, the Pacific Islander community, the tribal community, but one particular ethnic group, the Hispanic Latinx community, that only represents 13% of our population, has about 40% of the cases. So this is to tee up the importance of preventing other illnesses during this time of COVID, and flu is front and center. So I'm going to pass it over to Paul to talk about influenza vaccination.
Thanks, Joe.
As everyone knows, influenza sweeps through the country every year, generally starting in late fall or winter, and making people sick for anywhere from 12 to 20 weeks. And often filling up the intensive care unit beds in hospitals with severely ill patients. In Oregon, flu season usually peaks in January or February or December, but there are often a lot of cases well into March and even April. Flu seasons vary quite a bit in intensity, but the Centers for Disease Control and Prevention estimated that last season, that is the fall of 2019 and into the winter of 2020, about 38 million Americans were infected, about 400,000 had to be hospitalized, and about 22,000 died with influenza. There are a lot of common sense actions that will slow the spread of flu. So first of all, stay home if you're sick. Flu is often spread in workplaces and at schools, so absolutely protect others by staying home if you have symptoms. Next, cough etiquette is important. Like many respiratory viruses, influenza viruses are found in the saliva and mucus of the mouth and nose, and they get spread by coughing or sneezing. So, if you have to cough or sneeze, do it into your sleeve. Another option is to use a tissue and to dispose of it right away. Next, wearing a mask, which is required during the time of COVID when you're indoors or within 6 feet of others. And this will also help to prevent the flu. So if you have a mask on and if you have to cough though, you should still cover your cough with your sleeve because droplets are propelled in a cough with such force that many are going to get through the mask. Wash your hands frequently. and certainly after touching your mouth or nose or eyes. A lot of viruses, including influenza, can go from one person to the next quite readily by hand-to-hand contact. So use soap and water, but alcohol-based hand sanitizers are also going to inactivate the influenza virus, as they do with the virus that causes COVID-19. Most importantly for flu, though, because we have a vaccine, get vaccinated. The vaccine isn't perfect. It prevents influenza 40 to 50% of the time. But even if you get the flu, if you're vaccinated, you're likely to be sick for a shorter period of time, and you're much less likely to end up in the hospital. CDC says that influenza vaccine is the best weapon we have against the flu. And in fact, as bad as the last flu season was, it could have been worse. CDC estimates that vaccination prevented another 7.5 million illnesses, more than 3.5 million medical visits, 105,000 hospitalizations, and 6,300 deaths from influenza. Influenza vaccine is currently in good supply in doctors' offices and pharmacies throughout Oregon. And October is a great time to get vaccinated. Obviously, you want to get vaccinated before the flu season hits, but as long as flu is circulating, it's not too late to get vaccinated, even in January or February, which, as I've said, is when flu often peaks in the state of Oregon. But I got mine on the 9th of this month. So,
and I got mine last week. But we always think about, in addition to the flu vaccination, are there other ways of staying healthy during this time of COVID-19 and the flu? So you've heard this before, and we'll say it again, the wearing of face coverings is essential. And that's been proven by countries in South America, down in Australia, New Zealand, other places that have already gone through their flu season, that works well. Stay physically distanced at least 6 feet apart from your non-household contacts, and wash your hands regularly. But the other things to think about is the weather's going to be beautiful this week. Get outside and let your kids run off some of that pent-up energy. They haven't been in school, and they need to run around, and probably you need the break as well. Soak in some sunlight, boost your mood and your vitamin D, and keep in touch with loved ones. Laugh, share some jokes. You know, the other day I went and visited my mom and asked, how did your generation get through the Depression and World War II? And she told me that doing something nice for others gave everybody a sense that we're in this together and that we'll watch out for each other. We're part of a community. So maybe this week, go rake a neighbor's leaves, bake an extra casserole, leave it at a neighbor's house. Call an acquaintance that you know lives alone just to talk. I mean, doing something nice for someone else makes you feel connected and have purpose. It'll help you physically, emotionally, and immunologically. We know that people who feel better emotionally and are happier have stronger immune responses to infection. So with that, I think we're ready for some of your questions, and Paul, we can maybe go back and forth a little bit and have a conversation based on your questions.
Okay, well, the first
this question is from Sue. Are there any data to show that countries in the southern hemisphere that did a good job handling COVID-19 also experienced a less severe flu season? Joe, you had kind of alluded to this.
I kind of jumped the gun on that, and I apologize, but yes, Sue. So we know that those countries had significant less influenza this year. So we're talking about Australia, New Zealand, Chile, even South Africa had lower numbers of cases of influenza. And we think that it was largely because of the masking and the social distancing were quite effective. So Michelle asked, Paul, if masks work, why should I even get a flu shot?
Well, good question. We favor the so-called belt and suspenders approach. None of these prevention measures is perfect. You know, we've recommended a lot of things, from masking to vaccination to covering your cough to social distancing to hand washing. None of them is going to prevent 100% of infections, but each one of them will prevent some fraction, and the more of them that you do, the less likely you are to get sick. So we absolutely recommend both. Joe.
Yeah.
Naomi asks, I was unable to get the high-dose flu vaccine that's recommended for my age group. Should I get the lower dose one?
Well, Naomi, usually we recommend the high-dose flu vaccine for seniors. And ideally, if you could get one, we would recommend that you get the high-dose vaccine or one with an extra adjuvant added, this chemical added that makes your immune response greater. However, if that's not available to you and you can't get that, then absolutely get any flu vaccine that you can. You may want to call 211 or go to 211.org, and they can help you find a local source for flu vaccination. Paul, let's see. Shanika asks, isn't COVID different than the flu? I don't understand why a flu shot would help.
Well, okay, the flu shot is not going to prevent COVID-19. They're caused by totally different viruses. But remember, we've got COVID-19 circulating and even rising, and we're about to go into flu season. So what that means is there's two respiratory viruses that are going to be attacking the population. And that's going to mean more people going to the doctor for both diseases, more people going to the hospital, more pressure on our intensive care beds. And so we want to do whatever we can to prevent the flu, since we already have COVID right now circulating. So we want to avoid the double whammy on our health, on our medical system, on our hospitals.
Absolutely.
So that's the rationale for recommending the flu vaccine.
Yeah.
Should I get the flu shot if I'm immune compromised?
Wow, that's a great question. So someone who's immune compromised absolutely should get the influenza vaccine. These are some of the people who are at highest risks. And so I think all medical professionals would recommend that you absolutely get the flu vaccine.
Right, they're one of the highest priority groups for getting a vaccine. And if it were in short supply, we would be trying to reserve the vaccine for those high-risk groups of people. Maria asks, does the flu shot give you the flu? It seems like it just makes you more sick sometimes.
I know it seems like that, but it's not the case. It turns out that any shot that you get in your arm for influenza, it's an inactivated virus, a virus that cannot replicate. And so you can't actually get influenza from the shot. Now, granted, with any immunization, sometimes you'll feel sore or a little bit achy, or even have a little tiny low-grade fever after a shot. But that doesn't mean that you have influenza. And the other thing that happens is we tend to get influenza at a time when other respiratory illnesses are going around. And so sometimes people get the flu shot and get another respiratory virus and then mistakenly think that the shot gave them the flu. But again, getting the flu shot, you cannot get influenza. So let's see, Sarah asks, where can I find a free flu shot or flu shots in general?
Okay. Well, first of all, if you have medical insurance, and most Oregonians do, all of the insurances are going to be covering the cost of flu vaccine. So you can generally call your physician and get a shot in the doctor's office, or you can visit a pharmacy in Oregon and they will charge, but you could get reimbursed for the cost of the flu vaccine from your insurance company. I know that some places have been offering flu clinics. I don't know if you've seen them, Joe, but there have been hospitals around Portland area anyway that were offering free flu shots, so that is a possibility. If all else fails, I would call your local public health authority because they are not going to refuse you a vaccine based on ability to pay.
Paul, I think that's a really good point. And I brought up some data about that certain communities have been more affected by the COVID-19 problem. And what we're doing now is trying to do outreach with flu vaccines in these communities with either pop-up clinics or drive-by flu vaccinations, or even using emergency medical services like an ambulance with paramedics who go out with flu shots to communities. And they often will partner with these community-based organizations to give those flu shots. And we're using this as a testing mechanism or a glide path for when COVID-19 vaccine is available, how to get vaccine into these communities that have been historically underserved. Let's see. Sarah asks, we did Sarah. So how about Jennifer? Let's see, is it really all that helpful if flu shots are only 40 to 50% effective?
Absolutely. They're not 100% protective against catching influenza, but they're actually very effective at keeping you out of the hospital. So that if you happen to get influenza despite being vaccinated, you're much less likely to end up in the hospital. With a disease that is as common as flu and that puts as many people in the hospital every year as flu does, take whatever protection you can get from the vaccine. And I think I mentioned that CDC estimated last year that influenza vaccination prevented 7.5 million illnesses, 100,000 hospitalizations, and over 6,000 deaths. And that vaccine was about 40% effective. So even with that level of effectiveness, it prevents a lot of illness. Let's get it. And as I said, I got mine and I get mine every year, and I usually drag my kids in to have them get the vaccine as well. Me too. Definitely think it's worth it. So Joe, Alexandra asks, what about people who don't have medical insurance in Oregon?
Well, first of all, for people who don't have medical insurance, you may be eligible to sign up for the Oregon Health Plan, and I would recommend that you call 211 or go to 211.org to find out about how to do that. But secondarily, that contact will also give you an opportunity to look at some of these community-based flu clinics that pop up, or as Paul mentioned, the local public health authority in your community will give you an outlet for where to get your flu vaccine. Paul, I have a question for you. I think this will come up as this fall goes on, and that is, what do I do if I or a family member gets a fever and a cough? And how will I know, what should I do? Is it COVID, is it flu, and should I get tested for both, or what should I do?
Right, great question. The symptoms of flu and COVID overlap quite a bit. It's really impossible to tell them apart without getting a laboratory test. Both of them can give you fever, both can give you a cough, both can make you short of breath. With COVID-19, we also have noted that people can lose their sense of smell or taste. But we definitely want anybody with any of those symptoms to get tested for COVID, because we want public health to follow up. We're going to do contact tracing. We want people to isolate at home for 10 days after that period. But I would advise calling your doctor about this, because if you go in to get tested for COVID-19, your doctor can help you assess whether you should also be tested for influenza, because he may want to test for both. And I know that a lot of laboratories are starting to make test kits that will test for, you get two for one. You're going to get both test results for one sample that gets tested. And this is especially important if you're in one of those high risk groups for flu, if you're elderly or if you have underlying chronic diseases, because your doctor may want to start you on oseltamivir, which is an antiviral drug that's effective against flu. There aren't any drugs for outpatients to take against COVID-19, but for influenza there is, and so your doctor may well want to test for both.
Paul, can I ask a follow-up question? Let's say I get a fever and a cough, and I go in and get tested. What do I do when I'm waiting for the test? Can I go about my day? What should I do? Should I stay home? And what about once I get those results? How do I know when I can go back to work?
Right. Well, while you're still sick, you definitely need to take yourself out of circulation, because whatever virus you have, you don't want to be spreading it to other people. So stay home. See if you can have somebody do your grocery shopping for you if you happen to need groceries. When you're in the house with other household members, you want to keep 6 feet of distance and be wearing a mask. Do all those things that we've been recommending all along for COVID-19. If it turns out that you have COVID-19, your local health department will be in touch with you, and we are going to recommend that you isolate at home for at least 10 days. After about 10 days, most people are no longer contagious with COVID-19, and they can return to work or go about their business. Influenza, the period of contagion doesn't last that long. So if you have influenza but not COVID-19, in general, we just recommend that you stay home for 24 hours after you get better. and then you're not going to be shedding the virus anymore.
That is really helpful. Thank you, Paul. There was a question also from Bob about, Bob had heard about a study that the flu vaccine increases your risk of contracting COVID-19. What are your thoughts on that?
These are very preliminary data. I don't think there are definitive data that suggests that influenza vaccine increases your risk for COVID-19. Nobody is recommending that you avoid the flu shot, which prevents a definite illness because of a single study.
Right.
So it's sort of an interesting finding, but in general, we don't believe that a vaccine against one virus is going to put you at higher risk for a different virus.
And certainly the CDC has not changed their guidelines and recommendations about that all people over 6 months of age should be getting the flu vaccine this year, like every year.
Right. Okay, Melissa asks, what about people who are medically vulnerable and don't want to risk exposure by going into a doctor's office, clinic, or pharmacy for a flu shot? I think we talked about this a little bit earlier.
A little bit. I think, I think that those places where you will get your flu vaccine, your family doctor, your pediatrician, your internist, or the pharmacy are used to dealing with infectious risk, and they can make it safe for you to come in and get your flu vaccine. It's for those people who are medically vulnerable, it's so important that they get the flu vaccine because they are more likely the ones who might end up in the hospital. I think you have to depend on the safety and security of the places that give vaccinations. They're used to doing it, and they generally get you in and out pretty quickly. So I think you should do it. Lynn asks, given the similarity of symptoms, how do we ensure flu cases aren't counted as COVID-19 cases? That's a great question.
Sure. Well, in general, we're counting people who tested positive for COVID-19, and the test is very good at distinguishing flu from COVID-19. So I'm not too worried about that sort of miscounting going on.
I think it might come down to, sometimes we do have some presumed cases, so people who are exposed to a COVID-19, we would still, COVID-19 case, and they have actual symptoms, we would still consider them a presumed case, and we would still count them as a presumed case. Is that right?
Yeah, that's right. So you could have a fluke situation where one member of the household has COVID-19, the other member has symptoms from a totally different virus, influenza, but I think it's unlikely. I think it's more likely that either they're both going to have influenza or they're both going to have COVID-19. Let's see, Karen says, we're trying to get a flu shot, but we can't find one. What should we do?
Well, Karen, I think as Paul mentioned that if you have health insurance, I would go to your local pharmacy first, or your physician, local physician first, because there should be an adequate supply of flu vaccine in Oregon. I don't think that there should be a significant supply issue. If you don't have insurance, I would consider you could apply for the Oregon Health Plan, and meanwhile, you can call 211 or 211.org to find out the closest place where you could get a free flu vaccine if you don't have insurance.
Yes, 211.org is a great resource, or just call 211 or call your local public health authority, and they should be able to either give you the vaccine themselves or put you in touch with one.
For those
we're getting some questions on why we're wearing only face shields. If you joined late, you missed the explanation. But basically, we generally wear masks, but because a lot of our audience is hard of hearing and depends on being able to see our lips and mouth move, we're going with face shields just for this particular event. And we're also maintaining 6 feet of distance from each other so that we're not in proximity to each other.
Well, it seems like we don't have any more questions right now from the audience. Is there anything else, Paul, that you think that we should be telling people about influenza or prevent the mixture of influenza and COVID?
You know, I guess I really do get concerned because even before we had COVID, we would see in many parts of Oregon hospitals filling up And you know, they call it going on divert. You know, we don't have any more beds, or maybe we have regular beds, but we don't have any more intensive care unit beds. And so they end up having to send patients, you know, in rural parts of Oregon, sometimes a great distance, simply because there's no room at the inn, if you will. And that's because their beds are filling up with patients with influenza. So this happens sort of in spotty areas around the state. Flu can hit southern Oregon more than it hits northern Oregon, for example. But that's in a season without COVID. So I'm really pretty nervous that with COVID case counts rising right now and influenza season on the horizon, that the hospitals are going to get hit with a double whammy. Most of the COVID that we've been dealing with has been, you know, in the absence of influenza. We kind of went through a spring and summer and fall, but flu is ready to come back again. And we really need to do everything we can, you know, masking, distancing, hand washing, cough etiquette, and vaccination in order to minimize the double whammy that we're going to get.
I think that's exactly right, Paul. I think that when we look at some of the predictions for where we're going, even as next, let's see, November 5th, the estimate is that we'll be seeing case counts around 570. Now that 570 positive people, that means about 2,200 plus people who are actually infected. So not everyone who's infected gets a test, right?
That's every day.
In a day. And out of those people, we might get 40 or more severe cases that end up in the hospital. So as our case counts go up, the risk to overwhelming hospital capacity is going to be, is just from COVID alone, not from influenza. COVID alone is a substantial problem for us, and that's the other reason we're asking you to think about getting a flu vaccine to protect yourself and your family, but also to help us as a community to keep our hospitals open for COVID, which we do not have a vaccine for yet.
And I've seen a lot of these patients myself in the hospital who have COVID-19, and many of them are not only in the intensive care unit and not only on a ventilator, but they have to have their blood taken out and oxygenated outside the body because their lungs are so damaged by the COVID-19 infection. Patients with COVID-19 tend to stay in the hospital for a long time compared to many other patients. So again, I'm very concerned if we don't take these undertake these measures, what our hospitals are going to be hit with soon. Yeah. How will the COVID-19 vaccine be distributed when it's ready?
Well, the Oregon Health Authority has been working on a plan, a statewide plan, and has basically a framework that it's continuing to develop about how to distribute COVID-19 vaccine. However, we have a lot of experience here in Oregon just with these getting flu out to people, that we're using that as a foundation basically to build this COVID-19 vaccine distribution plan. You could probably speak more to this, Paul, because you're in charge of this program, and so.
Sure. Well, if and when we get a COVID-19 vaccine, and we don't have one yet, so let's be honest, they're still undergoing trials, and we're very hopeful, but until we see it, we won't be sure. But in the early stages, the supply will certainly be limited, and it's going to be tightly controlled by the federal government. So they're going to allocate a certain amount of vaccine to Oregon based on our population, and it's going to be prioritized for healthcare workers, because where do sick people go? They go to healthcare workers, and they put healthcare workers at risk, and we need to keep our healthcare system going. And then also for the most vulnerable people. You mentioned, Joe, earlier that 75% of our deaths have been in people over 70 years of age. And I think something like 44% of our deaths in Oregon have been among residents of long-term care facilities, skilled nursing facilities. And so they are a particularly vulnerable group in the population, and we're going to be directing the early limited supplies of the vaccine toward those long-term care facilities, both to the patients there and to the healthcare workers who are going in and out of the facility. After that, when the supply expands beyond that, then we're going to absolutely try to pull out all the stops. We're going to get it to clinics that see high-risk populations, clinics in some of those vulnerable populations like Hispanics who have had such high rates of disease. We'll be using pharmacies, we'll be using mobile clinics. We're working on contracts with emergency medical service providers to sort of take the show on the road and have mobile vaccination efforts. So it's going to depend, you know, it'll be phased in based on what the supply is like and how much our federal allocation is. I guess we have time for one last question. Do you also recommend the pneumonia vaccine?
Absolutely. Seniors are recommended to get a pneumonia vaccine, and we would definitely recommend it. And I think that's about it for us.
Right. So one shot of the pneumonia vaccine is recommended for people 65 years and over, and for people with certain chronic medical conditions.